Hi, friends. Thank you for joining us for another episode of Hello APGD, a neighborhood podcast about the Audubon Park Garden District in Orlando, Florida. I'm your host, Michael Lothrop, and today we'll be speaking with Dr. Carolina Brandan and Julie Turner of Airmed Ketamine Treatment Center, located at 855 Outer Road in Baldwin Park, just next door to Audubon Park. For more information, please visit them online at airmedk.com or on Facebook and Instagram at Airmed Ketamine Clinic. If you'd like to be a guest on the show, or if you'd like to be a sponsor, please feel free to message me on Instagram at HelloAPGDPod. Thank you for listening. Please note that this episode deals with sensitive mental health topics, including severe depression, post-deployment PTSD, anxiety, and suicide. Please take care when listening, and if you or someone you know is considering suicide, please contact the U.S. National Suicide Prevention Lifeline, dialing 988. If you're outside of the U.S., you can find your local helpline at befrienders.org. This episode is brought to you in part by Trevor Brown, Audubon Park resident and trusted Central Florida realtor with Fannie Hillman and Associates, proudly serving their clients for over 40 years. For listings, market trends, helpful home buyer and seller tips, email directly to Trevor at fanniehillman.com or find him on Instagram at Trevor Brown Realtor. And with me today is Dr. Carolina Brandan, founder of Airmed Ketamine Treatment Center in Baldwin Park, and Julie Turner, integration coach and founder of Life Coaching with Compassion. Welcome.
Thank you.
Thank you.
Thank you for being here. I'm so interested to hear more. I was checking out your website, starting with the name Airmed. It almost sounds like a military term, but it is from Irish mythology, rather.
Yes, it is an Irish goddess that cured the military personnel with plants.
Interesting. Okay.
That's why I chose Airmed.
Yeah, that's perfect. It has a nice ring to it. And Julie, you had gotten in touch with me, and you are an Audubon Park resident, mm-hmm. and you wanted to talk about kind of the discoveries that you've made personally with ketamine treatment.
Yeah, I've been kind of working on my own kind of healing journey personally for a couple of years now, and it's kind of led me into this whole new realm of healing, including ketamine. And I reached out to Carolina just on a whim, and she's right here. And it was just kismet because she was looking for someone just like me. I was looking for somebody just like her. Mm-hmm. And so we've only been together a month or two. It's not been...
Yeah. We fell in love immediately.
Wow. It was just
That's amazing.
Yes.
Yeah.
We met and just clicked.
Yeah. It was it felt right and good.
Absolutely.
Those initial meetings can sometimes be intimidating and awkward.
Sure.
It was like old friends almost.
Yes.
Right?
Yes, exactly.
That's fascinating. Yeah. And you were you familiar with ketamine treatment prior to meeting?
I was familiar with what it offers,
okay.
The background of it and where it kind of started and what it's used for and what it can be good for. I had personally done small doses of ketamine with my psychedelic life coach mm-hmm. previously and knew how much it helped me significantly, the small doses. And so since then, I have partaken in an IV treatment at the office so I could relate to what the patients go through. And so I have kind of the whole experience and the knowledge of what it can do mm-hmm. for us.
That makes sense.
Yeah.
So you yourself have been a patient, and you can explain what is to be expected from the yes. treatment and from a patient's point of view.
And it's always different for everybody, but yeah. I definitely have more of an understanding mm-hmm. of what the possibilities are and what to expect.
Yeah, I would imagine just each individual things that people are working on and brain chemistry and things like that. And I understand ketamine is FDA approved to treat some types of depression.
Yes, ketamine is a non-anesthetic drug that has been used since 1960s. So we use it for anesthesia mm-hmm. regularly. It's a very good sedation agent, also for pain, for short procedures. Now, the nasal spray is FDA approved to treat chronic resistant depression. And the way we use it in intravenous and intramuscular injections is off-label, but it's still authorized. We can use anesthetic doses of the ketamine in that way.
That's outstanding. Yeah, it's amazing. It surprised me. I saw an advertisement for ketamine before I kind of knew more about it, and it was in the news a lot, obviously, I don't know, 10 years ago or something like that, just as this drug that was being abused as a party drug. And that's, it's just those certain things that you only hear the bad things about just because it makes the news and people are mistreating it. This is obviously a whole different thing because it's small doses and it's over a period of time, and it's administered by professionals and with purpose.
It got a bad reputation because when you use it at a certain dose, it will leave the patient paralyzed. And the patient is stable, is still breathing, heart is beating, everything is okay, but the patient will not move voluntarily. So it can't react to something that has been done to them, either, aggression or even pain. Mm-hmm. When you use it as an anesthetic, that's exactly what you want. You want the patient not to move and not to react to a procedure. If you use it in the street, then you get the same reaction, and it led to the abuse and the bad reputation of ketamine. The way we use it in the clinic is sub-anesthetic doses. So it's smaller doses. When the patients are with us, they open their eyes and they know where they are. They can talk to us. They feel us. If we put a hand in their hand or we encourage them to breathe, anything like that, they're aware of their surroundings.
Mm-hmm. That makes a lot of sense.
And it all kind of goes back to that set and setting. I don't know if you've heard about set and setting with any kind of psychedelic treatments. It's like this whole new wave, right? Mm-hmm. In the whole world of FDA and Johns Hopkins and all that. And it just goes back to set and setting. You're in a safe space with the facilitator and the doctor, and you're able to kind of go to those places in a safe way.
And so I was reading also that ketamine enhances neuroplasticity, the ability of brain cells to form new connections with one another. Tell me a little bit more about that.
It increases the connections, like you said, between neurons. We use on our brains on a daily basis. We navigate the same pathways. So the connections that we use is like using the same avenue, like taking Colonial to go to the same store every day. You take the same street. With ketamine, you have new connections. They kind of wake up. So now you have alternative routes to take to go to the same place. That neuroplasticity effect lasts about 2 weeks after each session.
Okay.
And it's very important to tap into that effect because it allows you to create exactly those new avenues and revisit the memories that you may have, the feelings that you have. Now you have the ability to look at things from a different perspective. You're in another street. The things that are in that street will not look the same because you're looking at them from a different perspective. So it's a very good effect. We attribute a lot of the healing process of ketamine infusions to that effect of the neuroplasticity. It also increases the connection between the two lobes. That neuroplasticity opens up the connection between the two of them. So now it's like having two people inside your brain. Now they're talking.
Yeah.
It wakes up the neurons and makes them connect more often, and different neurons now are awake.
So you're accessing memories and parts of your brain that I know trauma can block a lot of things, and we find wherever our comfort zone is to block ourselves from that trauma sometimes. But really to get through it, you have to access it again. And it sounds like ketamine gives you a different avenue of accessing that trauma. Because I understand that you do a lot of treatment with PTSD patients, people who have been through pretty traumatic and awful things.
Yes. We have a structure in our brain that is one of the oldest from the evolutionary point of view. It's called the amygdala. I'm sure your listeners have heard of this. In the amygdala, we save very tightly our deepest emotions, our deepest memories, our fear. And it's like a nut. It's very tight. It's very close. And we just keep it there to keep us safe. In a moment of tension, you're going to tap into that amygdala, recover that anxiety, that fear, that memory that kept you alive, that made you hyper alert, that made you hyper vigilant towards a situation. The ketamine creates pores, I would say, opens the pores like in your skin. Mm-hmm. So now there's a flow of energy through the amygdala. And a lot of those emotions, memories, and fears are released. Now you have all the new connections with the neuroplasticity. So you're looking at those old fears, at those old memories from a different perspective. It's like crossing the street and now you have a different point of view of the same store that you were looking at before. So you're crossing the street with the neuroplasticity, with the new connection, and you're looking at that situation that created the PTSD differently, from a different angle.
Yeah.
And we work on that to heal that moment, to give you a new perspective and to release the fear attached to that memory, to that situation, and look at it differently. Mm-hmm. You're not the same person that you were when that happened. So now you're able to process it.
It's amazing to me, the mind-body connection and what stress does to the body, you know, our fight or flight responses. And when we can be in an office environment and there's no risk to our lives whatsoever, but we feel that intense fear, that as if something were threatening our lives. And it's what our mind does as far as trying to solve problems and feeling like just overwhelmed that you can't get through anything because there's too much to get through. And it sounds like one of the effects of ketamine is that it sort of releases that mind-body connection a little bit, just enough to where your body is a bit more relaxed and your mind is more relaxed. And you can make those connections and you can say, I am safe. And you can get through your trauma knowing that your body's not going to react that typical way that it has.
It's a very interesting effect because ketamine, like LSD, is a dissociative psychedelic. So your mind is going to dissociate outside of your body. You're going to be outside of your body. Like floating on top of yourself, you're able to look at yourself and you're not in your body. In that sense, you can, just like that, you can process things differently. You're outside of the situation, looking at it. Mm-hmm. If you really look at ourselves, our body, we are not an entity. We are a colony. We're hollow, and we have within ourselves a lot of other entities, viruses, fungi, bacteria that live with us. Without them, we can't even survive. We need them to absorb nutrients. We need them to interact with the world, with our environment.
We're an ecosystem.
We are an ecosystem, and a good percentage of our DNA, it's viral. We integrate with our environment through viruses. So you get a virus into your body, it gets inside your cell, it will attach to your DNA and replicate itself. But that part that attached to your DNA stays with you. So now you have the viral marker inside your body. So we are a colony altogether.
Yeah.
We're not ourselves. We have more than one brain. Mm-hmm. 90% of our serotonin receptors are in the gut. They're not in the brain. We have receptors in our skin, in our fingertips. Mm-hmm. Each sense that we have not only 5, we have way more than 5. Mm-hmm. Sense of balance, sense of orientation, they're all included into our senses. They are different brains. There are different ways that we interact with our environment. And the way we survive all these years from an evolutionary point of view is that we capture all of those and we save them in a place that we like to call the ego, that makes us survive. Now, our body knows that if you hear a loud sound, you immediately duck. That's an instinct. It's because you know that something else is coming.
Yeah.
Something is coming after that sound, or what produced that loud sound, it can't be good for you. So you immediately react to it. Mm-hmm. It's more than one brain. And in dissociation, on an altered state of mind, when you're able to get outside of this colony and look at it from afar, it gives you an incredible opportunity of looking at yourself and reacting in a different way. It's really marvelous.
It sounds incredible.
It's really good.
I've done breath work with a hypnotherapist, and that was pretty life-changing.
Yes.
I've done transcranial magnetic stimulation for trauma and depression after going through some pretty heavy medical situations with myself and my wife. I'm a cancer survivor, and my wife has ongoing autoimmune diseases. And that medical PTSD that I kind of learned about as I was experiencing it, nobody told me about that in the hospital. No. And, they don't want you to get it, obviously. They hope that you will not. But after what we had been through, I would have loved that advice. But luckily, we're pretty resourceful, and we are accustomed to going to therapists and, seeking treatment when we can't do it ourselves, and not relying too heavily on our support systems and families and friends and things, and finding new avenues. And it seems like there's just all of these things that are kind of coming into the mainstream, which is so incredible. Even just like the float tanks that people find, like meditative, just kind of having that sensory deprivation experience, and these things that, like, in the 60s they made movies about them and it seemed really far out and weird, and we've known about them forever. But I think that there's a lot of healing that needs to be done, and people are seeking new ways of healing, and healthier ways as well.
And lasting ways.
Yeah. Right.
The concept of treating mental health, PTSD, chronic pain, anxiety, depression with a psychedelic approach is what we're seeking is the altered state of mind. We still don't know enough. A lot of the studies that I research, they're actually, it's quite funny, they're proposed mechanism of actions. They're not definitive. We still don't know exactly, not even how you are depressed. What is depression? How can we find it, mark it, have a lab result for depression or anxiety, have something that says, oh, look at this, I did this image and this person is depressed. I mean, he may not know, but he is. We still don't have that.
Yeah.
So we're just starting to explore altered states of mind. And that is opening a door, fortunately, with something that is non-addictive, that doesn't cause any long-lasting damaging effects like medications do.
Right.
It is something that you're under the effect, you experience that, and you use that experience to heal. But it's not something that you have to do all the time. You don't have to take it every day. And let me tell you, once you have a deep altered state of mind, you don't want to repeat that situation too often.
Sure.
You need to process it.
Yes.
You really feel that, okay, let me wait, let me process this, and then I'll think about doing it again. But it's not something that you're going to jump and say, like if you're taking an opiate, you want to take it again and again. No, this you want to wait, you want to process, and then you think about doing it again. You don't want to do it too soon because it's really life-changing.
Yeah. So how long is a course of treatment typically? You were saying that the effects will last about 2 weeks, and then I'm sure it's case by case on how much treatment somebody is needing, but what are some of the averages as far as the length of time that somebody is administered ketamine treatment?
Well, ketamine comes in different forms. You can take it orally, you can take it intranasal, intramuscular, intravenous. I see the best results with intravenous infusions. Also because we can modulate the infusion and give the person while they're having the infusion more or less. Make it longer or shorter, depend on the experience that they're having at that moment. We recommend that people start with 4 infusions once a week for 4 weeks in a row. You have the immediate effect of the ketamine while you're having the infusion, that it will last for usually an hour, hour and a half, with chronic pain about 2 hours to 4 hours sometimes. That effect goes away within 45 minutes. That's the metabolic rate of ketamine. So after 45 minutes, the effect is gone. Then you have the first window of the effect, which is a boost in your mood that will last approximately 48 hours, sometimes 72. Then you have the third wave, which is the third window, which is the 2 weeks of neuroplasticity. With each infusion, you get that. When you repeat the infusions once a week, it seems that neuroplasticity gets augmented. And that is just my opinion. It's not a study to back this information, but it's my opinion that you see these effects that come, and we see it all the time. Patients come, they have not showered, they have, they won't look you in the eye, they are very sad, they don't smile, they answer yes or no, and when they come back for the third infusion, it's like a different person is walking through the door.
Wow.
They get a haircut, they're clean, they're wearing makeup, and they come smiling and asking and telling personal things and making jokes with us, relating to us. So I believe there is a cumulative effect of the neuroplasticity in those 4 weeks. Most of the studies recommend starting with 6 infusions, 6 weeks. A lot of people need more than 6. They need 24, they need 30, they need 2 years of ketamine infusions. But we see results, good results, with 4 weeks, 4 infusions.
That is incredible. And how many patients do you see on average per month, would you say? Do you have a lot of new patients coming in, and you have some existing patients that have been there for a while?
We're a new clinic.
Yeah.
It's relatively new, a few months only.
Okay.
So we started building up slowly. From all the patients that we have, about, I would say 30% continue to be our patients. They have the first 4, 6, 10 infusions, and then they call back every 2 months that they want to come again and have another infusion. So they stay with us. We're seeing about 5 to 6 new patients a week.
That's amazing. And just starting off and you're seeing that effect with that many patients, that is really, really incredible.
The reason I started Airmed and this journey of myself with the psychedelics is because I was exposed to the amount of PTSD directly through my son and his platoon. He lost several kids after they returned from deployment to suicide.
Wow.
And he had done everything he could to help them, and he couldn't. It destroyed him, and it absolutely broke my heart because they were under medical treatment, but still it was not enough. It didn't really reach their soul to heal them, the treatment. It was more medically treated with impersonal sessions at the VA, and it forced me to look for an alternative. And because some of them refused to take medications, they had seen what had happened to other veterans. They didn't want to go on chronic medications. They didn't want to take antidepressants. They had all the side effects from it, and they didn't want to do that. And there was no alternative.
Yeah.
And literally, I stumbled upon a study from Johns Hopkins of these underground doctors, regular doctors that were working underground with LSD and getting magnificent results on patients or veterans with PTSD. And it was something that it just crossed in front of me. I read it and it triggered my curiosity and I couldn't stop. I just went at it full force. I could just not stop reading about it. And I started to send these doctors, or at least the universities, I start sending them emails and asking questions. And a few of those researchers, they answered my emails and said, yes, this is happening. And they sent me links to other people that were doing studies with these. At the beginning, 8 years ago, it was mostly underground. Since then, it has, thank God, exploded.
Yeah.
It's now in the media. It's in shows. You can see it in the movies. You can see it everywhere in magazines. Celebrities are coming out and saying, yes, I did this and this heal me. So it's popular. Now it's exploding and people are really reaching out and trying to find out how to do this. One of the most common questions that we get from new patients is this addictive? Am I going to be addictive to ketamine? I'm going to go to the streets and have to buy it if you're not open. And I keep telling them, no, it's a completely different approach. So searching for an alternative, searching for something else. I come from a very, very traditional background. I come from a traditional medical practice. I was just doing anesthesia and I use ketamine every week, but we actually block the dissociative effect with benzodiazepines to avoid the patient dissociated so they don't get scared, because when you don't have the correct setting, that can happen. You can have anxiety. But after reading all of these, and actually I spoke with one of the founders of MAPS, Marcela Otalora, she was kind enough to actually have a phone conversation with me. And she said, I have a ketamine clinic in Colorado and we're doing great. She sent me some information. I said, well, I have the same resources. I have the same knowledge. And then I started to get pressure from my son's friends saying, you can do this. You are the person that can do these.
Wow.
Why are you not doing it?
Yeah.
So as scary as it was, I decided, okay, let's do it. And then I get blessed by people like Julie jumping into my way or looking for each other.
Yeah.
And, it just happens. It happens. Every person that has come to the clinic so far, it has happened organically. People just get attracted to what we're doing, to our message, and they just come, and then you meet them and it clicks immediately. It's just we're in the same path, we have the same goal, the same mindset.
Yeah.
And it is to help people have an alternative treatment.
That's incredible. And the fact that it was you as a mother trying to do the best thing for your son to alleviate his suffering in a healthy way and a sustainable way, and his friends as well. And you've done that. And what an incredible story. I mean, really and truly. And then to realize that you were put in this path for a reason. I mean, you have that background. You had researched, you kind of knew that, there was something out there that hadn't been explored fully, and now it kind of is. So this is like a perfect time for this type of treatment. And now you're making it available to Central Florida, which is just so fantastic.
It's exactly what we want.
Yeah.
I had a lot of resistance from my family. I guess the same way that a lot of people get resistance from their families traditionally.
Yeah.
That they're going to say, my God, you're going to do a psychedelic to heal. Is that safe? Is that the right thing to do? And it took a long time. And I had to embark on a journey personally for even my family to accept that this is safe and it is okay. And my father is 88, my mother is 85, and they're in line to get ketamine treatments themselves.
Wow.
Because they want to experience, they see what I do, they hear my stories,
Right.
None of those stories are my success. None of them. They're all each individual that has gone through the pathway, through the experience success. I am just a vehicle. I'm just the person that knows how to give ketamine.
Right.
The rest is every person's effort into confronting their reality, their fears, their emotions, and putting in the work to heal. So it's not me.
Yeah.
We're just a vehicle.
It's a team effort, right? And it requires the right tools and knowing how to use those tools as well.
Yes.
Because it's a precision thing. As you said, you can kind of adjust and you're monitoring so that somebody's not getting too much. And even if somebody were to get too much, it's not a situation where it just becomes lethal or something like that. So the risks, it sounds, are very low, even reading the side effects, and they were very minimal. And the fact that it's not habit forming, that if it is changing your brain, it's doing it in a positive way. And I'd heard somewhere along the line that essentially everything that we need is within our body, but sometimes we need something to unlock it. And I just find
wise
that
words.
So beautiful. Yeah, absolutely.
Very
because
wise, yes.
in this ecosystem, we have all of these tools and all of these chemicals, and they come out at times when we need them. But sometimes we don't know how to communicate to those places in our brains or our bodies to actually make that happen. So to use those tools and to find something that is so successful and such a breakthrough and something that has been around for so long too, just having those questions answered. I think that people hear psychedelics and they have a certain stigma attached to it because that was sort of,
yes,
the line of shutting it down. And, we could talk about corporate greed and how, all of the ways in which things that are helpful have been shut down because they don't make certain people money. But we won't go there. But we know that is a factor, right? It's some of these things that it's not a shortcut, but it's maybe the more correct answer than some other drugs that you're trading one problem for another. There are side effects with so many, and that's not to say that they're all bad, but we should be wary of those things. Just because they're prescribed often doesn't mean that they're the best for us, right?
I think that pharma or medications in general have helped humanity advance in giant steps. Mm-hmm. We have vaccines, we have antibiotics, and that has allowed humanity to reproduce, to advance, and to take some things for granted. Mm-hmm. At the same time, we have to be very watchful of the medications that we take regularly. Because like you said, some of them, if we don't know what depression is or exactly how to identify it, we don't know which receptors are involved, and receptors interact between each other. And that has also a genetic component. Your receptors are not the same as mine. Mm-hmm. It goes down to that level. So when we are treating these conditions that we don't know what they are exactly, manifest themselves differently on each person. The cultural background also has a lot to do with it. How you react to an event has a lot of genetic and cultural background to it too.
Sure.
And we're treating everybody with the same medication. Mm-hmm. And it simply doesn't work. Unfortunately, the system has gotten to a point in which if one medication doesn't work, then you add another, then you take another, then you try this one, and then you try this combination. Mm-hmm. So we're practicing in ourselves with all these medications. And after 20, 30 years of practicing, we're realizing it's not working.
Yeah.
1/3 of the global population is depressed. It's a lot of people.
It's a lot of people.
It's a lot of people who are depressed. And a lot of cultures hide it.
Yeah.
You're not allowed to express that sentiment that you are not perfect, that you are anxious, that you have a weakness.
Mm-hmm.
And this new approach to those conditions or those manifestations of our sadness are allowing us to treat it differently. Mm-hmm. Now, I have to tell you, it's not the psychedelics per se. The psychedelics, name it psilocybin, MDMA, LSD, DMT, or ketamine. They're one part of the treatment. Mm-hmm. The other part of the treatment is what Julie does. If you don't integrate, like she was saying about the set and setting, mm-hmm. if you don't have the proper set and setting, if you don't have the integration afterwards, you're only going to get part of the benefit. It's like taking half the tablet.
Yeah.
You need that other part to be in the process. You need to integrate what you went through because you have no idea what to do with that information. It's overwhelming. I have patients that say, "Oh my God, I just died." And I tell them, "No, you didn't die. You're here talking to me." Mm-hmm. And they say, "No, in my dissociation, I just died. Or I was just born. Or I went to my grandparents' house and I was 5 again. And I saw myself as a little kid again."
Wow.
So you don't know what to do with that information. It's overwhelming.
Sure.
If you don't integrate afterwards, you don't know what to do with it.
Right.
So you need that other part. It's very, I would say, as important, if not more, than the psychedelic per se.
And it's fascinating to me. I want to hear more about that for sure. We all have visions when we go to sleep. Some of us remember our dreams, some of us do not. And it's such a normal thing. Like nobody thinks twice about like, oh, you've got dreams? Like, what's that about? And like
yes.
where your subconscious mind is producing this experience that you can live through dreams. And so something like this, being awake and alert, even when I went through hypnotherapy and just having that, it was like, my Apple Watch tells me when I'm asleep. It was telling me, looking at after the fact, my body was asleep, but my mind was awake. And I was going through that whole journey. So that disconnection, that was another way of doing that. And these concepts that some people are not comfortable with the first time they hear about them, it's like, well, you have dreams, right? I mean,
dreams are very interesting. There is mm-hmm. a lot of debate between the psychologists of what dreams mean. Mm-hmm. I don't know enough to tell you or to have a formed opinion. The one that I like the best is the one that proposes that your subconscious is trying to tell you something. Remember we talk about having 2 lobes? You have 2 people inside your brain. It seems that your subconscious is the neighbor across the street. You have another one there watching everything, but that one can talk to you. Apparently, it can talk to you through dreams. So that subconscious is telling you something. Mm-hmm. So pay attention to your dreams.
Yeah.
I think after reading a lot about it, because I'm very curious personally what my dreams, I have vivid dreams. Mm-hmm. So they don't let me sleep in peace.
Wow.
They torture me and chase me all night long, telling me things. So I went in depth and read a lot about it. The person that I like the best is Jordan Peterson, that he says this. He says that it's your subconscious telling you something. So pay attention to it. The way I control my vivid dreams is by the way I go to sleep. So no screen time before I go to sleep. Mm-hmm. I don't want to read any news, nothing bad.
Yeah.
I try to read something constructive, something good, something funny, a loving story, something that I know that makes me happy or put me at peace or triggers my curiosity maybe. Mm-hmm. Then my dreams calm down a little bit and they still tell me things. And I'm able to process them better that way.
Yeah.
So it's very interesting how we can tap into the subconscious. By the way, another very interesting information, because you were talking about your breath work and the being under hypnosis too, right? Hypnotized?
Absolutely.
Okay.
Yeah. Mm-hmm.
You can achieve an altered state of mind without a psychedelic.
Mm-hmm.
One of those ways of doing it is breath work.
Mm-hmm.
So hopefully soon we're going to integrate that in the clinic too.
Cool.
Because it's an easy way to do it. You can do it anywhere.
Yes.
You can do it by yourself, and it's usually safe. People who meditate for 2 hours a day consistently, like the monks, they achieve altered states of mind.
Yeah.
That's why they can sit there for hours, because they're in an altered state of mind naturally.
An ecstatic dance is another way.
Yeah.
Ecstatic
Dance,
dance.
extreme exercise, so marathon runners, people who do these 100-mile races.
Yeah. Yeah.
There's a story of the, if you read the story of the peyote, is this girl, daughter of a chief, that went into this journey, and her horse got spooked, so she's left in the desert by herself, no water, no food, and she basically was walking around. She passes out, and in her dreams, nature tells her to eat this cactus. She ate. There's 2 cactuses supposedly involved in this story, the chacurna and the San Pedro. So she eats the cactus and has these visions. That's how the indigenous culture comes into the psychedelics. So it's part of their story.
Wow. The fact that a vision, a dream, basically informed her into finding even a deeper experience. I mean, there's so much that I think we just really don't know about the mind, right? And I think it's humbling, and it doesn't necessarily have to be scary if you kind of know some ways of working on things and working in a better direction. I think that everybody has been on a bit of a mental health journey, even, saying that a third of people are depressed. I believe that's probably undercounted even.
I think it has touched everybody one way or another.
It really has.
If it's not in their family, someone that they know, or someone that they know, someone at work that has issues, but it has, after 2020, has gone basically everywhere.
Yes. And so just given the circumstances of today and finding these tools to be very helpful and becoming more mainstream and available, it's an exciting time. I mean, I think there's a lot of opportunity. There's a lot of good information that's shared on the internet. Julie, I know your Instagram, you're very active on there, sharing things that you're learning and things that you want to teach and you're studying. Tell me a bit about your life coaching practice.
Well, my life coaching, I do integration coaching, obviously, and then the life coaching side of it, I'm most passionate about kind of helping people with adult ADHD, adults work through that. Science is showing now that ADHD is not genetic, it's trauma-based from our childhood. So kind of digging into that and accepting that, and tools to work with adult ADHD. Also compassionate parenting, like working with parents that, I'm a parent and we all get triggered and we have our own stuff, right?
Yeah.
And our reactions to our children, they're all based on our own things.
Sure.
And so basically working with parents that want to kind of be the parents that they wish they would have had all the time.
Yeah.
With that compassion and that understanding and just that being present, which is really hard in this day and age to be present, with our children.
Increasingly so.
Yeah.
Right? Yeah.
Very much so.
Yeah.
And it's a detriment to our children and our future, really. So those are what I'm really passionate about. And I usually work, I don't do less than 3 sessions, because one session isn't going to really, you're not going to get anything out of one session. And I do up to 12. And sometimes during my sessions about, halfway through or so, we get stuck. And it's usually based on something that we don't want to
Work
deal
on.
with or see or feel, because that's
Sure.
scary. And in those instances, I then will either refer them to Dr. Brandan for a IV ketamine treatment, or we could even do little small meditative doses at home through our coaching. And it's kind of just tap into what it is that's holding us back without going too deep. And so that's, I've found, been very beneficial as well for the people that don't necessarily want to or need to at this time go
Full into
full
it.
in.
Sure. Yeah.
So that's been extremely helpful as well. So yeah, but my true passion is that integration. That is where my heart is.
Yeah, it sounds like I hadn't even really thought of that component of this type of treatment either. So it's just a very interesting, just the aftercare and, obviously diagnosing up front and figuring out what somebody needs exactly, and then kind of treating them.
And it's funny because we have found that so many people come into the office, and they've come from other offices as well and have found us, but they come in and they don't have any integration. And part of integration is not only the after, which is key, but also the prep. And people just come in and they don't really have any idea of what they're looking for. They just know they don't feel good. And so with Airmed, the packages include me. And they include me with 2 30-minute sessions with each session.
Okay.
And so one of those sessions, it's highly recommended, is before your first treatment, so that we can kind of dig down and kind of navigate what is it really that you're coming for. Because people come in and they're just everywhere.
Sure.
And
the
then,
most obvious thing isn't necessarily the thing that really needs the work, right?
Not.
It's like, this is what they want to talk about, but we really need to talk
really
about this.
going on.
Uh-huh.
And then to set an intention. It's important to set an intention for your time. And so ideally 24 to 48 hours before their treatment, they would talk to me. We'd find what it is they're looking for. I would help guide them into an intention, share with them what to expect. And then they would work on that over the next day or two, journaling, thinking about it, being in it. And then they're going to have a much more profound first treatment leading into the next 2, 3, and 4, or however many.
Yeah.
It's just going to be a much better starting point. Like that catalyst is just going to be much more beneficial for them.
Yeah, there has to be a focus that is appropriate. And as you said, I mean, we have all of these distractions. We have all of these, just the concept of parenting, to a child, they look at a parent as like, well, this is your job. And this is who you are, and they only see them as that, right? And it's like, you're still the same person that you were before. It's just you have this other job, this other role, right? And the you that was you before you were a parent didn't go away, right? And finding that balance and still, nurturing that person that you were, and also being what you need to be for your child, and them responding and feeling like all of their needs are met, they're attended to, and you're present for them and not reacting to them. And just, I mean, there's so many ways that we can get in our own way, right? We have to unlearn those things that didn't serve us in the past, and it is find those
reactions.
Ways.
Those reactions are, for the most part, based in our childhood, and how we were treated and how we were not listened to, possibly. And, and so just kind of navigating into that and stopping and just thinking for a second, taking a breath instead of reacting, taking a breath and responding with compassion. It all just goes back to forgiving yourself, and giving yourself some grace.
Yeah. I mean, we all start out as dependents, right? And it's like, you have to find a way to be independent and not codependent, but you're still coexisting. And, just it's hard to know what's healthy sometimes.
Right.
You know, things may look as though they are, and then you kind of realize like, oh, this relationship really isn't serving me.
Mm-hmm.
And obviously in a family situation, you don't get to choose those. Like
Right.
everybody has personalities, and we're all trying to learn how to coexist
Right.
and give each other what they need, but also in an appropriate way, and not give too much when it's, you know, when they, I think one of the biggest things in my experience going to therapy was just learning that your parent wasn't responsible for giving you all of the things that you needed.
Mm-hmm.
And so those things that you did not get, like, they had to come from other places, and that's okay, right? And I think, you know, I had really great parents, or have really great parents, and it felt like they were there for all of those things.
Mm-hmm.
But in reality, they couldn't be.
Right. Because they come with their own stuff too.
Right.
Like they use the tools that they have, and they have their outside lives as well, right? They have to manage, and
and we're all just doing our best, right?
Yeah.
Or
we
hopefully,
are. We are.
Hopefully, we're trying to redefine what our best is. Yeah, some people don't seem to be doing great at it right now.
They're working towards it, though.
Oh gosh, I hope so. This type of work is so important, and I'm very excited about this journey that you're on, and the fact that it is so new, and at least to the area, to, you know, your clinic is new. So tell me about your location. You are in Baldwin Park.
Yes, we're in Baldwin Park. I think that area is called the Doctor's Row. It allowed us to have an independent building, like a little bungalow. So we have an independent entrance. You don't see other people coming in. There's nobody in the waiting room. You're not going to see anybody else. The clinic is all for you. And you have a different exit, so you don't have to see other patients when you leave the clinic.
Wow.
So it's very convenient, very safe. We have, all our rooms are private. So there's a door that you close, and you're there. You can release more. You can surrender more because you're in a private space. It's very safe. We have a minimal amount of furniture. We have no mirrors in the bathroom, nothing that you can hurt yourself with. So everything is soft and round and feels very safe. It's part of the setting to allow people to release and let go of their anxiety at that moment, because they don't know us. They come, you know, they have spoken with us, maybe they seen pictures, but they really don't know what they're going into.
Sure.
So it's difficult to just let go with strangers. We do not encourage family members to be with them during the infusion. They interfere, so it's better not to.
Yeah.
We do have the therapy dog. He's an emotional support dog, Bailey, that goes and greets everybody. And when someone is going through something difficult, he knows. And he goes in the room and he taps in their hands, demanding attention, checking and saying, "Are you okay? Are you okay?"
Wow.
Sometimes he goes into a room, he lays down, and he will not leave. You can't get him to leave the room. He wants to stay there with that person.
He's doing his job, right?
He's doing his job.
Yeah.
He's actually exhausted at the end of the day.
I bet.
When he comes to the clinic, we usually go on long walks in the afternoon. When we come from the clinic, it's a short walk, just enough to do his things and come back because he's tired.
Yeah.
He's emotionally drained from being there.
Isn't that incredible? Yeah.
He also likes to eat toilet paper.
Oh, boy. Oh, well, we all have our things, right?
He's working on his best.
Yes, exactly. He's in therapy too.
Oh, buddy.
And then we just started the massage as well.
Yes. Reading a lot about chronic pain. Chronic pain is very complicated. There's not only the pain that you have an initial injury or a medical problem that creates the pain. Your body learns the pathway. Those avenues that we talked before, your body learns those avenues and wants to stay there. So the pain, even though you don't have the initial injury or the physical problem can be better, less inflammation, or surgically corrected, you still have that neuropathway that tells your mind, feel pain, because you feel pain in your brain, not in your extremities.
Right.
So you have the neuropathway that you learn, and that creates anxiety, creates muscle tension.
Mm-hmm.
The combination of all of the above creates depression. Now you can't do the things that you like to do. You can't go out. You think twice. You change everything about yourself. You don't relax.
Yeah, you're kind of trapped in this cycle.
You're trapped in that cycle.
Right.
When you're trapped in that cycle, then you have to treat everything.
Mm-hmm.
You treat the pain, you treat the body, and you treat the mind. You treat the depression and the anxiety that comes with it.
Mm-hmm.
It works very well also with phantom pain, with people that have had amputations or severe injuries in the war. It works very well with that because it will teach your brain to go back to before the injury and not feel the pain. So doing a lot of research in that, because the infusions for pain are very long. Usually the patient doesn't dissociate as much. It's a low dose of ketamine with other components in the infusion that will help alleviate the pain at that moment. So doing that research for the third time, I found that it could be beneficial to have a massage while you're under ketamine.
Mm-hmm.
The ketamine allows you to have less pain because it's an analgesic.
Yeah.
It will lessen your anxiety. You will be more flexible and you are more susceptible to the massage. The touch when you are under ketamine is very important. You will feel your body differently. So when we, even in a patient that is dissociating heavily, we put our hand in their hands, for them, it feels as a gigantic movement and as an intervention almost. So having those long infusions paired with a massage, we are getting very good results. There's not a lot of people in the country doing that. We started doing that in an even more innovative way by doing it while we do the infusion, not intramuscular or oral. So once again, we intervene in the infusion, taking the patient as deep as they tolerate within safety because they're in a different bed, but the masseuse is there all the time protecting them and feeling the massage. So it's an interaction between the masseuse, she often cries, by the way, and the patient. She can feel the sadness. She can feel the anxiety. And she came back the first time and told me, I couldn't help but crying because I could feel the patient's sadness. It made me so sad. It kind of went from him through my hands into my heart.
Yeah.
And when the patient finished, we asked him, do you feel different? And he was, oh, I'm very happy. I have no pain right now. And she's crying.
Yeah.
She took all that sadness into her through that massage, through that contact. It was very special, actually.
What a transformation.
Yes, we're getting a lot of calls about, a lot of inquiries about the massages. And it's something that it's very different, new, and I have a lot of hope with that treatment.
That's so exciting. Yeah, that concept that the body remembers pain and it finds that pathway and it serves as maybe a reminder to protect us in a way, right? It's like, you have an injury here, or it's like the lesson, we don't know exactly why that is, but just the fact that the mind kind of does that, I mean, it almost seems like it can be, in a way, like sabotaging us, right? It's like, why can't we just let go of this pain on our own, right? But there's a reason.
Initially, it's to protect you.
Yeah.
Initially, we create that neuropathway, that first reaction. When you have pain, you retreat, you move, you protect. You're going to get away of the situation that is giving you pain.
Just like the loud sound, right?
Just like the loud sound.
Total instinct.
It is to protect yourself,
Yeah.
to protect your body. Remember, your ego only needs you to survive. Doesn't need you to be happy, just for you to survive. So that initial neural pathway is created to protect you. And then it becomes like a maze. You can't find your way out of it. You're stuck going around in circles, feeling that pain. Your brain seems to forget where to take an exit and get out of the pathway that created that pain or that feels that pain. You can tap on it again. But with the ketamine and the massage, we're showing you the exit. It's like a neon sign.
Yeah.
Take a ride, get out of there. And now you're going to be better.
The pain is almost a comfort zone because it's familiar, right? It's like, I've known this for so long, and it's just, this is what my body does, right? And then if we can have something to change our minds about that, which is, this is the tool for that, it's so incredible.
Are you familiar with Gabor Mate? He's a physician and author out of Canada.
I'm not.
And he calls things like that, like protection modes that happen, and they cause the pain, or they cause the ADHD, all these different things that we have that were very necessary when it happened, and they protected us, and they were our friend. But as we get older, we don't need that anymore, but we still have these things going on, and he refers to them as our stupid friend. Like they were a good friend for us when we needed them, but they just won't go away, and now they're just our stupid friend, and it's kind of
giving
balancing that out.
Bad advice.
Yeah.
Yeah, sometimes we need boundaries from those friends, or a break, or, we need to find ourselves outside of that relationship for a while, and it's difficult, and I think people are resistant to change, but then when change is kind of thrust upon us, I think that's when we find our best opportunities to seek out those changes and be better and be healthier and grow. Yeah. Absolutely. Yeah. It's amazing what pain does for us, and we're meant to feel some pain. It's informative, but when it blocks us from living our everyday lives, that's when we need intervention.
All our emotions serve a purpose.
Yeah.
All of them. Pain, anxiety, fear. They all have the purpose of protect you, of adapting you to a situation. But it's like Julie said, then they become that friend that won't go away, even though you want to. So we have to learn to say, enough. It's time for you to go someplace else.
I've named mine Susan. And I'm like, thank you, Susan. I'm okay.
You can go
and that
away
really
now.
Helps, 'cause it
Yes,
pulls
you can go away
me
now.
out of the equation.
Yes.
Susan is not me.
See, it's dissociation.
Exactly.
She's dissociated from you. Exactly, not you.
No offense
but
to
somebody
any
else.
Susans out there,
No offense to any Susans out there. We love them.
Sometimes we need a name for it too. It's helpful, right?
Yeah.
Just like I will call this.
I'm able to
this,
separate
right?
it.
Yeah.
From me.
Yeah.
I don't know. Yeah.
That's a beautiful concept. That's very helpful.
Yeah. Really nice.
It's so simple and so true, and I can see getting some use out of that for sure.
Yeah.
Do you want to talk about a little bit about the psychedelics that will be authorized hopefully soon?
Absolutely. Yes.
Okay. So we have the Multidisciplinary Association of Psychedelic Studies, MAPS. They are the leading organization in the United States to the FDA approval of other psychedelics. They have been working for 35 years constantly and very successfully, I would say, to approve these other treatments, to take them out of the stigma and bring them into mainline treatment. Hopefully next summer, 2023, we will have MDMA approved and psilocybin. Some of the states, like Oregon, is already, they have a program that I get their newsletter every month, that they are already working on how to legalize and work with psilocybin. Psilocybin comes from the mushrooms. The mushrooms have to be organically grown in a controlled environment, so they're not contaminated and they're safe. And then you have that legalized. You have the legal providing or practice of the psychedelic, of the psilocybin to the patients in a safe environment, in a safe setting. And then you have the therapy part with it. So Oregon is working with it, and Colorado actually just decriminalized MDMA and psilocybin also. Mm-hmm. There are other states that are coming towards doing the same. We hope that here in Florida we will be allowed to work with those new or have more access to other psychedelics. Like I mentioned before, genetically we're all different. Our receptors are different. Mm-hmm. And you may need one psychedelic, I may need another to benefit more from the altered state of mind. Mm-hmm. It will tap or go better with me or with a different person, also depending on what you're treating. That is still on the unknown. So when we have more than one psychedelic to work with, it offers an even better opportunity for people to have access to these psychedelics, to this treatment, and benefit from it. So MDMA and psilocybin.
That's so promising that it could happen so quickly and that we're seeing
Yes.
some states be successful in it. You think of how beneficial these drugs have been in proven lab settings time and time again for half a century at least, right? I mean, there's so much data on it, and so much of it has been blocked, and we're finally getting past that to where like this can help a lot of people. And I mean, ketamine's a first step, obviously, and for the people that it does work well with, and that is what they need, that's incredible. And that we have that tool now, and hopefully we'll have those other tools soon as well, because as I said, there's just so much healing that needs to be done right now.
If you research the history, all the cultures in the world have a mind-altering substance that they have used along the years, along evolution, mm-hmm. that aids them in progress, aids them into that path of time. All of them. The only culture that has no documentation of having a mind-altering substance is the people from Alaska. Because nothing grows there.
Right, yeah.
So you don't have access to anything.
Wow.
But all the other cultures in the entire world, in all the continents, have in history documented a mind-altering substance.
Thousands of years. Yeah.
Yes, since we can find out.
And they use it for spiritual reasons, physical ailments.
Yes, for everything.
Preparing for battle and difficult tasks.
If you ask the indigenous people of Central America, how do they know about ayahuasca, which is the combination of two plants that you have to cook? And they keep saying the same thing. The plants told us how to do it. Mm-hmm. The plants told us how to cook them so we can get DMT, because that's what they get. Mm-hmm. Ayahuasca is DMT. And you have to combine it so when you drink it, your body can absorb it. Your brain can absorb the DMT. So it comes with another enzyme that blocks something else. I don't want to get too technical.
DMT is in everything, like every kind of vegetable, right? Like everything.
And we have
it in
receptors.
Yeah.
Mm-hmm.
Yeah.
That's the other interesting historical point, that we have receptors for those substances. We don't have receptors to eat rocks or to process certain grasses or certain plants. We have receptors to all the psychedelics that we use. They have effect on us because we have receptors that we have evolved to have. So we have evolved consuming these plants. Otherwise, we couldn't have it. It's, from the evolutionary point of view, is impossible.
Yeah. And there's some theory even that goes as far as to say that human consciousness came into play because of psychedelics. Like we have evolved from the start and kind of got to where our brains are because of that transformation that those things have done.
The trippy monkey?
That makes sense. And as you said, the receptors, these are things that are meant to be tools in our lives, and they get the stigma about being used like recreationally and things like that, but these aren't really things that people, as you said, want to do all the time, because these are not experiences that are going to be like, I need this to function. It is something like a dream where it is like, okay, that is serving a purpose, and I need to think about what purpose that is. And we can all relate to dreams, right? It just being awake and conscious and physically there for this experience that is out of body, but still in your mind and making new connections. I think it's just a very exciting time. It's fascinating.
It is.
Yeah.
The neuroscientist Sam Harris proposes that once you experience an altered state of mind, you can never go back and look at your reality the same way. It's impossible. It has already changed, and you start to question everything.
Yeah.
I like that idea.
Yeah.
And it gives me hope that the more people that experience an altered state of mind will question their current reality and questions the things that they're doing, and that we as a society will be better in the long run because of the effects of an altered state of mind.
I mean, the world is changing so much around us right now, especially just the rapid pace of, just thinking about how the world is in comparison to when I was a kid, and I'm 45, so it was a little bit ago, but not that long ago, and so much has changed. And I can only imagine what things are to come in the next 10, 20 years. And so us kind of adapting to those changes, this is possibly the future for us, right? It's like we need to coexist with whatever is around us and whatever is happening, and finding new ways to connect and finding new ways to adapt. And these are all available to us, right? And hopefully more so in the future. Yes.
I want to believe
that. I do too. Well, thank you both so much.
Thank you.
The website that people go to find your clinic?
airmedk.com.
Excellent.
So our name with the letter K from ketamine.com.
Excellent. And you are on social medias as well?
We have Instagram, Facebook, TikTok.
Yeah, you have to do all those things now, right?
Yes.
That's just the way of things. Yeah.
Thank God we have someone that is doing a magnificent job taking care of all of that. So
yes,
it's out of my hands. I want to concentrate in just my clinical part.
Absolutely. We can only do so much, and we have to have those boundaries and delegate appropriately. It was so lovely talking to both of you and meeting you both.
Thank you.
Yes.
I hope we were not awful.
Oh,
you won't have too much to edit.
This is wonderful. There's really some amazing stuff. Very little editing.
A lot of information.
A lot.
Yes, a lot of information. A lot of information. Yeah. I personally have been talking about this without pause for 8 years. I'm very popular at parties.
I mean, everybody wants to know this stuff too, right?
Once you say one word, you will attract a crowd.
Yes.
So I have to be very careful on what I say. Because once I say, what do you do? My romantic partner is an attorney. And when I go to his events, they all look at me, oh, you poor thing, what do you do? And I said, well, I have a ketamine clinic. And they go, what? So they're all around like, what do you do? And is that legal?
Right.
That's the second question.
Uh-huh.
What do you do? And then, is that legal?
Yes.
So it's very easy to attract a mob when you start talking about psychedelics.
And there's very good reason that it is legal, and yeah, just because it was abused and that's how we all know about it, it's a household name for a bad reason.
Exactly.
And now it can be a household name for a good reason.
Yes.
Finally.
With podcasts like yours.
Well, thank you. I just doing my part.
Thank
We're all
you
doing
very
our part.
much. Thank you. Yes, absolutely.
All right, we'll talk to you soon. Hello, APGD. A Neighborhood Podcast is brought to you in part by Stardust Video and Coffee, Audubon Park's beloved neighborhood cafe, bakery, bar, and meeting place, located at 1842 East Winter Park Road. We're also sponsored by Red Light Brew Pub. Founded in 2005, Red Light is widely known as the source for world-class imports and microbrews. A wide selection of natural wines, plus award-winning beers brewed in-house. A full kitchen is in the works with an amazing menu by Chef Jess Tantalo. Located at 2810 Corinne Drive, please check out Red Light for all things beer and wine and soon food. Our theme song is by Christopher Pierce, and special thanks to Trey Hester for all of his help in making this podcast a reality. We do hope you enjoyed this episode. If so, please click subscribe and leave a review if you'd like. We'll see you next time.